On, we will go to Superintendent Scaff School Report, item 7.01.
Okay, if we can pull up the Return to Learn update presentation, please. All right, as President Fitzgerald just recently noted, as you know, usually our response to public comment is provided via response in our FAQ or other forms of communication. As the spokesperson for the district, I would like to begin by addressing a couple of comments that were made at our last board meeting. I want to begin by, first of all, acknowledging even comments that were made by members of the community this evening, acknowledging and understanding that a number of members of our community and our youth are working to address mental health issues. At the last meeting, an individual spoke to the board on February 16th, identified herself as a staff member at Linden Oaks Hospital. The individual spoke about the high number of hospitalizations they are seeing at Linden Oaks as a result of keeping kids out of school and as a result of self-harm. As a follow-up, I reached out to and spoke with Gina Sharp, president of Linden Oaks Behavioral Health. By the way, Ms. Sharp is also a Naperville 203 resident and parent. Gina and Linden Oaks have had a long time mutual partnership with Naperville 203. While we cannot discuss specifics of causes for hospitalizations in this forum, Gina did share that what they're seeing at Linden Oaks is consistent with what behavioral health providers are seeing nationwide. She also indicated that she would talk further with her leadership team to get more specific information we can share with our staff to ensure that we are collaborating to provide the support we can for our students. Gina was supportive of our efforts in 203 and appreciative of our partnership, and I know that partnership will continue. What I can share with the Board of Education is that overall in our district, the number of hospitalizations among our high school age students is down compared to the number of hospitalizations at this time 1 year ago. Again, not an attempt to minimize the mental health issues we are seeing, but in terms of wanting to give you a picture of really kind of where we're at. We are committed to continuing to support all students in their social, emotional, and mental health. And we are committed to continuing to partner with organizations like Linden Oaks to do so. Another individual spoke at the meeting on February 16th about the harm we're causing by not allowing high school age students to participate in athletics. I addressed this briefly in my comments at that meeting, but would like to once again address it. I feel it is important to once again share this information because I believe it serves as an example of the efforts being made by this school district and our willingness to allow students to participate as much as public health guidance allows. Our high school students, since the summer, have been participating in official Illinois High School Association conditioning, training, practices, and competitions to the full extent allowed by the IHSA based on the guidance it receives from the Illinois Department of Public Health. And we will continue to allow full participation as allowed by the IHSA. Any deviance from the IHSA guidelines could jeopardize both individual and team eligibility in the future. Since the IHSA is the governing body for interscholastic competition in our state, it is imperative we follow these guidelines so we do not put our individuals and teams in jeopardy of being unable to compete. Unfortunately, I know for many of us this serves as an example of the occasional conflicting guidance we do get, because it is beyond frustrating to know there's a way to allow basketball games to be played, but public health guidance still makes fully attending school in person a challenge. And finally, while not comments made at the board meeting, I would like to address a rumor that has been circulating via social media groups about next year that seemed to get a little traction. The posts were stating with a sense of authority that Naperville 203 was planning to move to a 4-day week permanently, even after COVID restrictions are lifted. That is false. While we communicate our plans for the remainder of the year, we will communicate our plans for the remainder of the year in the coming days. There are no plans to make a full-day, asynchronous, non-student attendance day part of future school district calendars. Community members are reminded that decisions about our plans, our programming, or anything related to the school district will be communicated only by the school district. Please consult our webpage for information. My team and I will now present an update to the Board of Education and to the community. Tonight we'll again review the health and safety metrics and guidance that DuPage County Public Schools must operate under. We will provide the board and community with a status report of our current hybrid model. I also want to provide a glimpse into our district leadership planning process we have been using with an overview of ongoing practices we are engaging in to develop and refine our learning models. Finally, we will review the coming steps around increasing our in-person students. Dr. Igo will begin by sharing information about the most recent guidance we are following. As you are aware, recommendations from the CDC were updated on February 12th, resulting in updates made by the DuPage County Health Department. It has been noted from time to time by people making public comment that our guidelines change. It's important for you to understand that our practices change as a result of changes made by our public health officials, not for any arbitrary reason. Dr. Igo?
Thank you. As we discussed at the last board meeting, and Mr. Bridges just mentioned, on February 12th, the CDC released updated guidance on how to determine when and under what conditions to provide in-person instruction. Important takeaways from the new guidance are that in-person learning has not been associated with substantial community spread. K-12 schools should be the last settings to close and the first ones to reopen following any increased mitigation strategies. When the 5 key mitigation strategies are consistently implemented, especially mask wearing and social distancing, transmission spread within schools is limited. For schools to provide in-person learning safely and to limit the spread within schools, they must consider the level of community transmission and its impact on the risk of transmission within our schools. Schools should use a phased mitigation strategy that increases or decreases the intensity in which mitigation strategies are applied based upon the community transmission level. Following the release of this guidance, the DuPage County Public Health Department has updated their guidance to align with the CDC phased mitigation strategy. Therefore, we will also be updating our practices to be in alignment with the CDC and the DuPage County Public Health Department. The first step in implementing the phased mitigation strategy is to assess the level of community transmission. This is done by weekly monitoring the number of new cases per 100,000 people and the overall positivity rate. This is consistent with what we have been doing since the beginning of the school year. However, there are 2 important changes under the new guidance. One is that indicators should be reflected of the data from the last 7 days, and the second is that we should use both indicators to guide decisions. If the 2 indicators suggest different levels, the actions corresponding to the higher thresholds should be used. You can see from this chart that there are now 4 levels of possible community transmission, and the numbers that align with those levels have been adjusted to account for both the new use of 7-day data and the additional transmission level. Once we know the level of community transmission, the CDC and the DuPage County Health Department have provided guidance on how to leverage the mitigation strategies to limit the spread within schools. When the community spread is substantial or high, mitigation strategies should be intensified, and when it's low or moderate, mitigation strategies should be reduced. Regardless of the level of community transmission, schools must consistently layer the 5 key mitigation strategies for supporting a healthy environment. Those are consistent and correct use of masks, physical distancing, hand washing and respiratory etiquette, cleaning and ventilation, and contact tracing in combination with isolation and quarantining when necessary. Schools should prioritize consistent and correct uses of masks and physical distancing, as those have the greatest potential for reducing transmission. Schools who use voluntary weekly testing as an additional mitigation layer can differentiate how they test based on the community spread as well. When transmission is low, testing can focus on staff only, and when transmission is moderate, substantial, or high, it should be expanded to include at least 10% of students participating in in-person instruction. The CDC recommends that testing is voluntary for both students and staff, as it would be unethical to require someone to participate in a test in which they do not want to be a part of. How we engage in social distancing can also be adapted based on the level of community transmission. Under this new guidance, when levels of transmission are low or moderate, schools should focus on providing 6 feet of distance to the greatest extent possible. If 6 feet of distance is not possible within a classroom, then schools should focus on maintaining 6 feet of distance among classes, cohorts, or pods of students. If community transmission is substantial or high, schools must provide for 6 feet of distance at all times, including when they are in a classroom. Putting all of that together, full in-person learning is recommended when community transmission is low or moderate, because there are times when 6 feet of distance can be reduced due to the lower risk of spread within the schools. Hybrid learning is recommended when community transmission is substantial or high, because 6 feet of distance is required at all times due to the increased risk of the virus spreading within our schools. So using the new guidance, what is the level of community transmission for District 203 and what are the learning recommendations? Our community health metrics are gathered from the Surgical Outcomes and Quality Improvement Center at Northwestern Medicine. COVID data by zip code website includes all of the zip codes within our district boundaries. As of Sunday, February 28th, there are 108 new cases per 100,000 people, and our positivity rate is 3.18%. The number of new cases per 100,000 people indicates community transmission is high, and the positivity rate indicates community transmission is low. Since the two indicators suggest different levels of transmission, we would follow the guidance for high community transmission. When there is high community transmission, schools are required to have 6 feet of distance between individuals at all times. Given the high number of students who are participating in in-person instruction, it is not possible for us to provide full in-person learning and maintain the required physical distance at all times. Therefore, hybrid learning continues to provide the safest way for us to provide in-person learning. There's been discussion among community members that our numbers of new cases has fallen within the moderate range, and therefore full in-person learning should occur. However, that information does not align with the information posted on the COVID data by zip code website. Community members can find a link to this website and the zip codes it includes on the district COVID dashboard if they wish to monitor the data for themselves. So what needs to happen for us to be able to provide full in-person learning? We need the community spread to be within the low or moderate range of transmission, which means that we have less than 50 new cases per 100,000 and a positivity rate at or below 7%. When the community spread is within this range, we're able to have students within a class, cohort, or pod be within 6 feet of each other, which means all students who elect in-person learning would be able to attend. When community transmission is low, within the lower moderate range, social distancing will focus on maintaining 6 feet of distance between classes, cohorts, or pods of students. Mrs. Posey will now provide an update on attendance, increase in in-person learning, and additional experiences provided for our students.
Thank you. As you can see from the chart on this slide, a majority of our students are participating in the hybrid in-person model across all levels, and attendance rates are in the mid-90s across both hybrid, in-person, and online models. We have learned that our model has a larger percentage of in-person learners than some surrounding districts, and we also have a large number of students who opted for this model and are attending every day. While this is a huge celebration, this creates a hurdle for us in bringing more students in daily. Remember, we have to keep 6 feet spacing to the greatest extent possible. We need to limit interaction between pods, and large spaces cannot have over 50 people. Early childhood students in the PFAE and IEP strands have already been increased to 4 days per week, allowing for a schedule that is fairly close to traditional with the exception of Mondays. At the elementary level, principals and their staff have lengthened the 2.5-hour in-person day for more and more students based on attendance, engagement, and assessment information. This has typically been occurring between the 10:45 and noon period of the school day, allowing targeted AM students to stay longer and targeted PM students to begin earlier. Based on the most recent survey forms sent out to elementary parents for trimester 3, we are expecting an additional 445 elementary students in person beginning on March 16th. Junior high students have remained constant at a 72% in-person rate, and their daily attendance remains high. The junior high administration has worked with PLCs, counselors, and other staff to identify those students that may need additional support, whether it is by attending up to 4 days per week, additional time during the afternoon intervention block, or by other means. High school in-person rates have dropped slightly from the original survey date to 66% currently, but daily attendance rates are consistently high. We believe this to be partially due to those that were defaulted to in-person because they did not initially respond, opting for online learning, as well as many high school students sharing that they are doing well online and would like to finish the school year in that model. As changes occur, both high schools look to maximize our spaces with students who might need additional support as identified with grades, attendance, engagement, and work completion, looking to provide up to 4 days of in-person where possible. In addition to our in-person learning, we have focused on offering an increase of experiences and activities to enrich and expand school-based opportunities for students. We are grateful for the Board of Education's support of our partnership with DuPage Children's Museum and are excited about the upcoming plans for our 5th grade students to participate in on-site, in-person outdoor education. All junior high 8th graders will participate in a virtual field trip to the Holocaust Museum. High school incubator students continue to meet with their mentors, and health occupation students have guest presenters each week, which is a virtual version of their typical site visits. We are happy to report that sports and activities are continuing to meet in person following the IHSA regulations, which are different than the guidance that schools are required to follow for on-site learning. Dr. Knowlton will now provide an update on our vaccination efforts.
I'm proud to announce the existence this Friday of a vaccination clinic that we've coordinated with Wheaton-Warrenville School District 200. We began the process of soliciting staff members that are interested in participating in this opportunity. We anticipate that it will be available beyond just this week, and of course that's dependent on supply. Next bullet has to do with the fact that we had a robust response to the Edward Elmhurst Health opportunity. A little lag because of delivery quantities and the weather issues, but we continue to have staff that are working through receiving vaccination through Edward Elmhurst. And then, of course, we have people that are pursuing vaccination opportunities on their own through other entities in the community. I continue to stay engaged with Jewel Osco Pharmacy as well as Meyer Pharmacy. We've been doing some pre-planning in terms of setting up a site in the event that we have access to vaccination through either of those two entities in the near future, hopefully. We continue to collaborate with DuPage County Health Department, Regional Office of Education, as well as DuPage County Superintendents to understand where we are with this process and what the issues are outstanding. And then lastly, obviously the primary issue relative to obtaining this for our staff and the rest of the community that are in 1B has to do with the availability of vaccine, the coordination of the distribution efforts. So doing the best we can to try to chase down opportunities for our staff that are unable to do so independently.
During the pandemic, we developed new processes and structures to support ongoing plans for returning to in-person learning this year. The actions listed on this slide demonstrate the continual efforts used to engage leadership and departments across the district in planning conversations and actions to be responsive to the continual shifts in the education landscape and health and safety guidelines. We have many teams devoted to this work, all with the same goal of returning as quickly as possible to in-person learning. These planning structures and actions continue and will continue throughout the year and summer as we build our plans for the return to in-person learning this August. So long as our state government or public health officials don't tell us we can't, we plan to be in person 5 days per week next school year. Once again, so long as the state government or public health officials don't tell us that we cannot, we plan to be in person 5 days per week next school year. And we are planning to be there before this school year ends for those students who choose to be in person. We are actively planning for an increase of in-person learning this spring as the metrics continue to look favorable. 6 feet of social distancing right now is still the greatest barrier, but if we consistently trend toward the low to moderate transmission range, that allows us greater flexibility and the ability to increase our in-person instruction. Bringing the greatest amount of students back for an increase in the amount of learning time has always been our goal, and we are hopeful the metrics will continue to allow us to get there this school year. At the March 15th board meeting, we will communicate more in depth our models for bringing in all students who elected for in-person instruction once community transmission levels are within the moderate range. It is my expectation, based on what we know and what we expect, this will occur after spring break. The current online option will remain for those who have chosen it for the remainder of the year. Along with increasing in-person learning this year, our plans for the 2021-2022 school year have been underway. The most desirable plan, and one we are actively planning for, is to have all students in person every day following our traditional schedule that we abruptly shifted away from on March 13th, 2020. However, those plans remain contingent on the safety guidance we receive from various public health agencies. It is imperative that district and building leadership continue the process of planning for next school year today, and we already have been. It will be critical that we plan a parallel scenario to our traditional school day that does include 6 feet of social distancing with limited space consideration. The slide articulates some of the actions associated with planning for the upcoming school year. We will update the Board of Education community as our plans evolve. It is our hope that the Illinois State Board of Education, CDC, IDPH, and any public health agencies communicate their expectations and guidelines early so districts have the proper time to respond and shift if further restrictions are placed on districts, and we have been working with our advocate groups on this very topic. As stated over the past few months, communication is a critical component of our Return to Learn plan, and there are many important messages being shared across a variety of platforms. As mentioned in previous meetings, we want to make sure that everyone who signed up for surveillance testing, surveillance screening, is participating. It is easy to forget to bring a sample on the day it's due. To help with that, Communications has shared a toolkit with participating schools to send reminders to families via text, email, and over social media. District will also be sharing this on social media platforms and in the weekly Talk 203. That's our update for this evening. My team and I will be happy to answer your questions.